Hi everyone, my name is Dinesh Sirasena, and today we're going to be talking about injections to the posterior aspect of the elbow. As mentioned in the previous video, when scanning the posterior aspect of the elbow, you can have the patient either sitting or lying down. In both orientations, the palm is placed on the surface of the examination couch, and this exposes the posterior aspect of the elbow. You can undertake the injection with the transducer either in a short axis or long axis orientation. Here, in the short axis, we are introducing the needle in plane and aiming for two targets. And here are the two main targets. So it's either the triceps tendon if you're undertaking a PRP injection, or the posterior fat pad in case there's posterior fat pad impingement, in which case you might consider steroid, or the posterior joint line if you're doing something like steroid or PRP. When undertaking the injection in a long axis orientation, you might be aiming for the posterior joint line or the fat pad more often. And this can be done using an out-of-plane technique. With the transducer in a long axis orientation, you can perform injections to the posterior fat pad or joint line using an out-of-plane approach. With the transducer placed longitudinally over the posterior aspect of the elbow, the needle is introduced as perpendicular as possible to the skin and as close as possible to the transducer. The needle is then guided directly down into the posterior fat pad or the posterior joint line. And this is what you're aiming to achieve. Basically, to bring the needle directly down into that posterior fat pad or the posterior joint line, depending on where the target is. Thanks for watching. I hope you found the video informative and it adds to your knowledge of musculoskeletal ultrasound and interventions. If you did, please remember to hit the like down below and subscribe to the channel for further updates. You can also follow me on Twitter and Instagram, and remember to check out sportsmedinfo.sg. Thanks for watching again, and I hope to see you all very soon.